Erin Henderson-Lacerdo, Executive Director at the Association for Infant Mental Health in Hawaii and soon-to-be mother of 2, is now here with our next question. Erin.
Aloha. COVID has laid bare and exacerbated the stressors that families face, from not being able to find childcare to struggling with violence in the home and or mental health. There's a direct correlation between a healthy family home and a thriving keiki. A recent study revealed an incredible 81.9% of voters think it is important for Hawaii's next governor to prioritize programs that address mental health and family support needs for families and young children in the next budget. As Hawaii's next governor, what kinds of programs would you put in place to remove stressors that for families, starting with parenting support and mental health needs?
Dr. Green.
Thank you. That's a brilliant question. We unfortunately have a severe shortage of mental health care in our state. If you're in the rural areas, I was the doctor in KHON2 and Kohala for all these years, there's no behavioral health whatsoever. People are self-medicating with drugs. More than 500,000 people in our state, especially in the rural areas, don't have access to mental health care. What we need to do is we need to change our view of mental health care. Mental health care has to be viewed as primary care now. We should do loan repayment for all of the healthcare professionals in our state. That would include social workers, psychologists, psychiatrists, and primary care providers. That way we can get that primary care and that mental health care to the people. We have to have a trauma-informed healthcare system as well, and I think that that is the real first place to start for our state.
Thank you. Mrs. Cayetano.
So I believe that we need to address mental health in a different way from how we've been doing it. And that is to provide a continuum of services through designated facilities on every island, especially with regards to the rural areas. You know, they're the ones who have the least amount of access. And we need to find a way around that. So I believe that having a continuum of services to address mental health, and I'd also look to see how we can partner with the schools to see if there's an opportunity there to have resources to support our children. But with respect to mental health, that needs to be elevated, and I will do everything to support that.
Mr. Kahele.
You know, there's a saying that an ounce of prevention is worth a pound of cure. I really believe that approaching mental health care, we need to approach it as a state from a preventative position. We need to enable early access to affordable healthcare services. We need to embrace traditional, native, indigenous healthcare and services. We need to support a strong system of healthcare providers, and I really believe, finally, we need to reposition Hawaii as a global leader, as a place to heal. People come from all over the world to heal here in Hawaii. It is a traditional values that we have. It is the aloha spirit that we have in all of us. And I believe if we approach it from that perspective, we can make a major difference in the lives of Hawaii's people.
Thank you. And thank you to our sponsors and guests for their insightful questions for the candidates.